The biggest concern for getting parents' perception is also the age group we looked at. I mean, parents of children who are 8 and under are going to be a main agent of making change for the children in their home environment, what the family routine is. So it doesn't really matter what a child's motivation is at 5 per se. If their parent isn't on board, it's not going to happen. So knowing the parent's perception is the first step to motivating the parents to make change and to getting a sense, is this a priority? Is this something that's very important or very concerning to them? If it's not concerning, you're not going to get any further with making recommendations for change. So it's an important first step for the identification and to start some type of lifestyle change. Not even say they have to lose 10 pounds, but maybe they shouldn't have 4 glasses of juice a day, maybe just 1. We did the study specifically to look at parents of fairly young children, children under 10, because it is a subtle difference from a weight standpoint. It's not a 10 or 15 pound difference, it may only be a 5 pound difference. So we wanted to see how good parents could guess, and then we actually measured their height and weight at the visit to see how accurate they were, and then we asked their perceptions of it. And it was concerning because all this attention around the obesity epidemic, there are still parents who don't necessarily recognize it. Some of it may be they haven't been told by the pediatrician, because not all pediatricians are using BMI in all their offices for all their visits. But some may also be a certain amount of denial. Parent identifies their child as looking like them. They consider themselves to be healthy or normal. Whether they're healthy or normal or not is a different story, but so they don't want to assign a blame or have blame assigned to their parenting because their child is overweight or obese. So it's a little bit of maybe lack of information, but a certain amount of it is definitely either a denial or a lack of concern. The biggest difference among girls and boys in terms of perception of overweight was actually that overweight girls were recognized more so than boys who were overweight. And that gets to the part of parents getting a lot of messages and girls getting a lot of messages of what their body image should be in this country. So while the rates of obesity between them weren't all that different, girls were recognized far more frequently than boys were. The parents of overweight children didn't have a concern about their health status. They didn't identify them as much, they didn't think they had a health problem. The parents who were more concerned about their normal weight child thought they were underweight and had more concerns. They might be more susceptible to infections, get sick easier, not getting enough vitamins. So the disconnect there again was just kind of really surprising. When you look at the epidemic of obesity in this country and the trend that's been going on the past 30 years, it is concerning because that stigma still exists, that concern is still there when most children are rapidly becoming overweight and normal weight kids are now being misperceived as underweight. We're losing kind of a sense of what's the appropriate size.